Welcome you all for the next part of the question discussion. So, next question they were asking regarding ischemic colitis. Okay, so ischemic colitis means ischemia, blood circulation has become reduced in the colon area. Okay, due to the blood circulation reduction, tissue damage will be happening, and as a part of that there is an inflammation is happening in the colon, that is called as ischemic colitis. Blood circulation reduces due to so many reasons. Due to the hypoperfusion, okay, the blood circulation to the colon area, it is not reaching properly due to cardiac failure. Okay, heart is not pumping blood, and because of that blood is not reaching into the colon. Okay, through that way you can get ischemic colitis due to the main reason is hypoperfusion. So the reasons for getting hypoperfusion, one of the reason is cardiac failure, hemorrhagic shock, pancreatitis, then hypovolemia. So these type of reasons, because of that blood flow to the colon area reduces, and because of the tissue damage will happen. As a part of the tissue damage, our body will be response to this damage. So that time there will be inflammatory changes are happening. Okay, so this is called as ischemic colitis. So one of the reasons for getting the blood circulation reduction is hypoperfusion. Another one reason is thromboembolism. There is a blood clot is forming in the blood vessel. Okay, the main blood vessel which is supplying the colon is superior mesenteric artery and inferior mesenteric artery. So if there is a clot is forming in the superior or inferior mesenteric artery, through that way blood circulation will reduce, and because of that you can get inflammatory changes, and then that condition is called ischemic colitis. And due to the prolonged hypoperfusion, it can result in the transmural ischemia, like fulminant, like if for continuously, if the tissue is not receiving blood supply, then it leads to the complication as gangrene formation, perforation, peritonitis. So these are the complications of the ischemic colitis. Symptoms of the ischemic colitis are abdominal pain, severe abdominal pain, cramping will be there, abdominal swelling, then diarrhea, blood mixed stool, nausea. Okay, these are the main symptoms of the ischemic colitis. Abdominal pain you will be feeling in the left side. Okay, more commonly you will be getting the abdominal pain in the left side, and that area, lower quadrant. Okay, lower quadrant, left side, you will be getting severe abdominal pain, and there will be severe tenderness also will be there. And there is no specific investigation to confirm the ischemic colitis, so we can do the blood test. In the WBC count will be increased, you can see. Okay, because of this inflammatory changes, increased WBC count will be there. And you can do CT scan, endoscopy, colonoscopy, flexible sigmoidoscopy. So these are the investigations we can do for confirming the ischemic colitis. Okay, so these are the main things related with the ischemic colitis. Next one is crust syndrome. It is also known as limited cutaneous form of systemic sclerosis. Okay, it is one of the type of systemic sclerosis. So another name is limited cutaneous form of systemic sclerosis. Systemic sclerosis is a connective tissue disorder. Okay, so here you will be getting the 5 important clinical features. So this togetherly called as crust syndrome. C stands for calcinosis. There will be increased calcium deposition, you can see especially in the fingers. Then Raynaud's phenomenon. So the blood circulation to the fingertip is reducing. So because of that you will be getting first of all cyanosis, and then there will be whitish discoloration of the fingertips, you can see, that is called Raynaud's phenomenon. Okay, then esophageal dysfunction because of the sclerosis. Sclerosis means hardening of the tissue. Okay, sclerosis is hardening of the tissue. So what is happening, the connective tissues are getting hardening, and because of that esophageal peristaltic movement will not be happening properly, and because of that there will be increased acid reflux, GERD conditions, you can see. And there will be sclerodactyly. S stands for sclerodactyly. Sclerodactyly means the skin will become very thickened because of the connective tissues are getting hardening. The skin of the body will getting thickening, and because of that you can see in the fingers it will be very tightened skin you can see. Because of that you can't fold the fingers properly because of the severe thickness and tightening of the skin. That is called as sclerodactyly. And the fifth one is telangiectasia. So that is known as dilatation of the capillaries. That will be seen as a red mark on the surface of the skin. Small red dot like structures you can see, that is called telangiectasia, that is indicating dilatation of the capillaries. So these are all happening because of the hardening of the connective tissue. Okay, so here in this crust syndrome mainly all the symptoms are focusing in the skin disorders. Okay, so calcinosis, Raynaud's phenomenon, esophageal dysfunction, sclerodactyly, telangiectasia. These 5 symptoms are togetherly called as crust syndrome. For identifying crust syndrome, it is little bit difficult. So the investigations you can find in the blood checkup, there will be positive for anti-nuclear antibody, ANA, anti-nuclear antibody, and anti-centromere antibody. These two things are mainly indicated for systemic sclerosis, this crust syndrome. Okay, presence of ANA and ACA. And another one investigation is skin biopsy. Okay, so these are the investigations for confirming the crust syndrome. Okay, so it is a connective tissue disorder. Next question was, anemia of chronic disease can be differentiated from iron deficiency anemia by how we can differentiate this condition. So anemia of chronic disease. Chronic disease means you are suffering from an illness since 3 months. Okay, since 3 months you are suffering from an illness. So because of that what happened, there is some inflammatory changes will be happening in the body to cope up with this disorder. Okay, as a part of this inflammation, as a part of this inflammatory changes, whatever the iron which is circulating in the blood, that will be used for the inflammation purpose. In anemia of chronic disease, due to the chronicity of the disorder, whatever the iron which is circulating in the blood, that will be used for the inflammatory response. Okay, the inflammatory response that is mainly done by the macrophages. Okay, immune system, macrophages, they will be using whatever the iron which is present in the body, they will be utilizing, especially in the blood circulation. Okay, so whatever the iron which is present in the blood, that will be used for the in this inflammatory changes. So you will be getting decreased TIBC. Okay, TIBC is total iron binding capacity. Okay, total iron binding capacity, they are indicating how much iron is circulating through our body, especially in the blood circulation. Okay, so in the anemia of chronic disorder, already whatever the iron is there, that is already been utilized. So because of that you will be getting decreased TIBC. Okay, and another one more thing we can differentiate is the normal or increased serum ferritin we can see in the anemia of chronic disease. Serum ferritin means they are indicating the iron storage. How much iron is stored in our body inside the RBC cells, how much iron is stored. Okay, for iron storage, if you wanted to see iron storage, you have to check serum ferritin level. So here in anemia of chronic disease, whatever the iron which is present in the blood circulation, that is only utilized. So because of that you will be getting decreased TIBC, but the iron which is present inside the RBC cells are not utilized. So because of that you will be getting normal ferritin or increased serum ferritin you can see. Through that way we can differentiate the iron deficiency anemia. Okay, in iron deficiency anemia, iron is not at all there. We are not having, through the food we are not taking iron inside. So what happened? Already iron deficiency will be there. So you, in the blood checkup, you will be getting reduced serum iron, and the ferritin also will be very less. Serum ferritin also will be less because iron is not there. So because of that, iron storage will not be there. Okay, and whatever the in the blood, whatever the iron will be there, the TIBC will become increased you can see. Okay, the old iron which is present in the blood, that you can see in the blood circulation. Okay, so in iron deficiency anemia, decreased ferritin and increased TIBC you can see. In anemia of chronic disease, decreased TIBC, increased ferritin you can see. Okay, anemia of chronic disease, there whatever the iron which is present in the circulation, that is utilized, so storage of iron will be there. In iron deficiency anemia, iron storage is not at all there, so you will be getting decreased ferritin. Okay, and whatever the old iron which is present in the blood circulation, that will be there, so you will be getting increased TIBC. So in this way you can differentiate these two conditions. Next question was, PIP joint is fused, proximal interphalangeal joints are fused, and there will be pain in hand and general malaise is there. So what is the diagnosis? So the proximal interphalangeal joints are getting fused in the advanced osteoarthritis condition. So the option B is the correct answer. Next one was in TURP, transurethral resection of prostate. Okay, this is usually done in the case of benign prostatic hyperplasia, TURP. This is a surgery which is to be done in the as a part of the treatment for the BPH. Okay, so while doing this resection, whatever the enlarged portions of the prostate, that we will be scraping out from the area. So while doing that scraping out, there will be excessively fluid will get absorbed into the body. Okay, so it results in the water intoxication, so that is called as TURP syndrome. Okay, TURP syndrome is the term applied to the constellation of symptoms and signs caused primarily by excessive absorption of irrigating fluid. While doing this operation, there will be too much of fluid will get inside into the body. Okay, doing this operation, the sinusoids will get open in the prostate, so they will absorb all the water content, and because of that it results in water intoxication. So because of that you will be getting hyponatremia. This is the electrolyte change you can see in the as a complication of TURP. While doing the TURP, this is one of the complications you will be getting. There will be excessive water get absorbed into the body, water intoxication. Because of that you will be getting hyponatremia. Then along with that you will be getting hypervolemia, because too much of fluid is get inside in the body, so the volume of the blood has, like fluid has increased, so it result in the hypervolemia. Okay, then it result in the pulmonary edema, hemolysis, coagulopathy and bladder perforation. So these are the other complications you will be getting due to the TURP surgery. So the question number 20 was, in TURP which electrolyte change you can see is hyponatremia. Okay. Next questions we can see in the next video.